This just might be the number one misconception regarding varicose veins. Varicose veins are actually the most common vascular disease in the United States. And if untreated, it's an estimated 30% of individuals with varicose veins will experience medical complications, including blood clots, skin discoloration, or skin ulcerations. So absolutely, the number one cause of vein disease is genetic. So we can thank our mom or dad. In fact, if both your mother and father have venous disease, then you have up to a 90% chance of developing venous disease as well. However, these days we have great treatments that are minimally invasive, that are covered by insurance, that are patient-friendly, they're very safe, and they're very effective to offer individuals that have vein disease. Actually, insurance, including Medicare and Medicaid, do cover the treatment for chronic venous insufficiency. The reason being is chronic vein disease can affect up to 40% of individuals in the United States and have medical complications that require more medical resources and cost us more medical dollars to treat. Actually, most spider veins are harmless. However, in 1 out of 3 people with spider veins, this could represent the beginning stages of underlying venous disease. So if you have spider veins and you also are developing leg swelling or leg discomfort, then it's wise to get these spider veins evaluated. In the past, when vein disease was treated primarily by vein stripping, this was performed in the hospital in the operating room by vascular surgeons. These days, vein disease is treated in the office setting and is a minimally invasive type of procedure. So many other physicians from different backgrounds are now interested in treating vein disease and are qualified to treat vein disease using the modern technologies. Unfortunately, compression stockings do not cure vein disease. However, compression stockings can help with the symptoms of vein disease. It can slow the process down from worsening, and they can be protective against blood clots as well as leg swelling in certain situations. So we still recommend compression stockings to help, but it should not deter somebody from getting more definitive treatment that we offer today. It was once thought that women of childbearing years should wait until after they're done giving birth to address their venous insufficiency. However, these days it is now recommended to address your vein disease in between pregnancies so you don't have to suffer with each additional pregnancy. Actually, men do develop varicose veins. It's estimated that 15% of men under the age of 50 and about a third of men over 50 will develop varicose veins. In fact, by age 60, over 40% of men can develop varicose vein disease. Wound care is an important component of healing venous ulcers, but it's not the only component. We have to address the underlying issue, which is often the venous insufficiency. If we just do wound care, most wounds will heal. It's estimated that 90% of wounds can heal with good wound care. However, recurrence can be as high as 50 to 60% if the underlying issue is not addressed. If we address that underlying issue and perform good wound care, we can not only cure the wound, but we can also prevent reoccurrence. So the underlying cause of varicose veins is venous insufficiency, and venous insufficiency is a chronic condition. So although we can fix the varicose veins, for some individuals they may recur. Currently, we treat the varicose veins, get the legs in a better state of health, and then we watch our patients every so often. A success for maybe half our patients is a few little things every so often, the leg's healthy. Some herbal and non-medical treatments for spider veins and varicose veins can provide temporary relief. Most of these components or herbals do have some anti-inflammatory properties, which again can give temporary relief, but they do not address the underlying issue. And for most people, they're ineffective and people see no benefit long term.